Next, from the press briefing room at the state capitol, representatives of the Healthcare Council of Illinois expressed their support for continuing the temporary state income tax increase in order for Illinois' healthcare industry to maintain proper funding levels and care for the sick. This runs about 20 minutes.
We are pleased to stand today with our colleague, Representative Greg Harris, and our partner in care, Denise Gaines, representing SEIU. We're standing together today in support of the continuation of the tax increase that was put into effect 3 years ago on a temporary basis. This money, continued money, is vital to the care of the nursing home residents we take care of every day. I would like to introduce two speakers that will follow me. The first is SHAEL BELLOWS, who's the co-chair of the HCCI board. And the second is Bob Hartman, who is the co-president of the Illinois Council on Long-Term Care. SHAEL?
Thank you, Pat. I am SHAEL BELLOWS, SHAEL-BELLOWS, and I am the co-chair of Healthcare Council of Illinois. We, the Healthcare Council of Illinois, providing long-term care nursing services to residents statewide, stand before you today in support of continuation of the tax increase. Here with us, we are delighted to have Greg Harris, Representative Greg Harris, along with Denise Gaines, the Legislative Director of SEIU for Illinois and Indiana. Great champions for this cause. We have asked them to stand with us today to show a united front in support of the continuation of the tax increase. This is important to our residents who rely upon our dedicated caregivers for a number of reasons. One, the tax increase will provide a continuation of much-needed services for our residents, the frail, elderly Medicaid clients who gave so much of themselves to us when they were young and now must rely upon all of us to provide care for them. Two, to preserve the tens of thousands of jobs throughout every community of the state of Illinois and their families. And three, to maintain the well-being of the communities in which all of our healthcare facilities are located from one end of the state to the other. To discuss the impact thereof, I call upon Bob Hartman.
Thank you, SHAEL. My name is Bob Hartman, H-A-R-T-M-A-N. I am the co-president of the Illinois Council for Long-Term Care. To illustrate the significance of what SHAEL said, let me give you a preview on the impact of just those healthcare providers that are standing up here with me today. Together, just this group, a small portion, a small segment of the rest of the state, we care for 13,000 frail and elderly Medicaid residents. We employ over 27,000 caring and dedicated employees, and our annual payroll is $440 million. Our collective Medicaid budgets just for this group exceed $320 million. So the 14% cut that is being proposed in operations as an alternative to maintaining the tax increase would be $44 million just to the providers that are here today in this room. It's a dramatic, unsustainable impact if it happens. Other social service and community service providers serving the elderly will also be impacted, but it'll have a most meaningful impact on us here. So we would appreciate continuing support for the current tax situation. Thank you. Pat?
Excuse me. One of the true champions in the General Assembly for this issue is Representative Greg Harris, and it is our honor that he is standing with us today, and I'd like to give him a chance to make a few remarks.
Thanks, Pat. Greg Harris, my district is in Chicago, but I'm here as chairman of the House Human Services Appropriations Committee today. And I want to thank all the folks who are both caregivers and the folks who are the owners of buildings in which some of our most frail and vulnerable citizens are residing for standing up for maintaining an adequate level of revenue for this state. So we're not talking about increasing income taxes. We're talking about keeping our tax levels at an equal level to what they are now. Should we see a decline in these, those of us who care about our parents, those of us who care about a relative who may be disabled, whether they live in a facility or they're living in a community, whether we care about a child who may be suffering from abuse or neglect, all of these services are at risk. Not only are these services at risk, community-based services such as substance abuse, mental health care, supportive housing, all of these are at risk should our state's revenue decline. So I want to thank the folks who are standing here for taking a time to come down to Springfield and to stand up for those residents who are the most frail, the most vulnerable, and the most in need among us.
Thank you. Thank you, Representative Harris. Finally, in speakers today, we're pleased that Denise Gaines, the Legislative Director for SEIU, Illinois, and Indiana, is standing with us. SEIU is one of our great partners in care, and we welcome Denise to the podium.
Thank you so much, Pat. Thank you. Good afternoon. My name is Denise Gaines, and that's Gaines. And as Pat said, I serve as the Legislative Director for SEIU Healthcare, Illinois, Indiana, Kansas, and Missouri. I'm here today because with nearly 93,000 members who provide vital care to children, seniors, and people with disabilities, we are the largest union in the state. On behalf of our members and working families all across Illinois, we thank you for providing me the opportunity to speak about the importance of the Illinois General Assembly acting to really support and acting to make sure that revenue is kept whole in this state. It is necessary that our state lawmakers understand the importance of maintaining our current income tax rate to avoid harmful and devastating cuts to health care and other critical services and programs that support working families. I'm pleased to be joined today by both the Healthcare Council of Illinois and the Illinois Hospital Association, who I know has offered their support. Our organizations may not always agree on a variety of topics, but we all agree on the importance of maintaining the current state income tax rate. On January 1st, 2015, Illinois will suffer a revenue collapse, a budget shortfall of at least $2.3 billion in FY15. Unless the General Assembly acts to maintain the current income tax rate, Illinois will go over the fiscal cliff. The results would be crippling of the Illinois economy and devastating cuts to vital state programs and services like the following. The community care program, tens of thousands of seniors will be denied home care. The community care program, also known as the CCP program, helps seniors remain in their own homes by providing in-home and community-based services to over 90,000 seniors. The Child Care Assistance Program, which represents about 32,849 providers, will not be able to participate in the state's Child Care Assistance Program. That means about 23,000 families and 41,269 children will lose access to child care services for parents that need to work or go to school. It is not fair. Adults with disabilities, single mothers, and children to have to suffer the consequences because of the state's broken tax system. It's why we must preserve the current tax rate to protect our key priorities, such as education, public safety, and health care. Without the continuation of the current income tax revenues, all of these areas would face harmful and devastating cuts. In addition, unless the General Assembly acts Thousands of employees will lose their jobs, while tens of thousands of vulnerable Illinois residents will lose vital services upon which they depend on for their basic existence. That's why we call upon the General Assembly to maintain for children, seniors, and people with disabilities by passing the FY15 budget that maintains the current tax revenue. We are calling on our state lawmakers to demonstrate leadership on this very crucial issue and vote for a responsible budget that protects working families in Illinois and supports our communities. Thank you so much for your time. Thank you.
Thank you, Denise, for those remarks. And, I might add, this is a historic event for us to stand together, and we appreciate that very much. So the majority of us up here are representing nursing home residents. Although, as SHAEL mentioned in his remarks, and so did Bob, there are many other social service agencies that also would be impacted, and that's what Denise was highlighting in her remarks. So that concludes the prepared part of our remarks. If anybody has any questions, we are open to answering them.
Can you be specific about some of the things that would be cut if the tax expires?
It's difficult for us to envision how many facilities could remain in business with a 14% cut to their operating budget. That's difficult to quantify and even think about. Some things that we could potentially put on the list, although every facility is going to make their own decision about how they deal with this, is lots of facilities are engaged in many activities that the residents participate in. We have a full range of activities every single day. Those things would be at risk. Residents interfacing with the community and engaging in the community and being out in the facility, out of the facility to the best of their ability in the community, those kinds of things would stop. It's possible that many facilities would decide to no longer take Medicaid residents because what we are paid for the care of our residents is already below our costs, even without considering a potential 14% cut. So for us, it would be devastating. For us, it truly is doomsday. But there's a nuance about nursing homes that we would like people to understand that makes us a little different from other providers that might be able to cut services, streamline services, make decisions about services they no longer render. Nursing homes are under a federal mandate and a state mandate to provide services. If we have a resident in the building that has a certain set of needs, we're required to provide those needs. So nursing homes are in a unique position, and we'd be rather caught in the middle between the state budget and what our residents require. Because we would be mandated to provide those services regardless of reimbursement. That's why I'm saying that some facilities might make the decision to just no longer care for Medicaid residents because we wouldn't be able to bridge that gap.
Pat, can I follow up on that?
Sure, Terry.
Almost every industry I talk to, people are frustrated by mandates that they have to do something one way, even though the administrator might say it's a waste of money because they make us do it this way. So what I would, trying to be devil's advocate, there's going to be taxpayers out there going, well, we got to make cuts, why can't you people make cuts? You're wanting our money. But otherwise we would be getting back in our pockets. Mm-hmm. Would there be an approach to say, why don't we go a legislative way to cut unnecessary mandates so that you can control your cost instead of necessarily having to have more money in what might be a mandated inefficient system?
Terry, I appreciate the question, and we often try to take a look at what regulations can be rolled back Many legislators have come to us and asked us if they could help with that. The sticky wicket there is that the majority of the requirements that we have are federal requirements that then are enforced or instituted by the state of Illinois. So to really make some substantive changes in our regulatory environment, we would have to go to our friends at the federal level and make changes in federal law. And as you know, that's not something that we can do quickly, even if there were an appetite to do that. We've been working with legislators for the last couple of years in Illinois to advocate for no additional mandates. And the General Assembly here in Illinois have been very, very understanding of the fact that considering this environment, we've been able to avoid putting additional requirements on us. But to really solve the regulatory issue, we would have to do it at the federal level.
Is there any effort being made to do that?
Right now, we are not getting feedback from our congressional delegation that there's an appetite to do that right now. We will keep pressing and giving them examples of things that could be done. There are some critical regulations, though, that we would want to make sure got maintained. Illinois was one of the first states to require criminal background checks of employees. And we would want to make sure that those kinds of things stay in place because that goes to the safety of the residents. Illinois was the first state to institute criminal background checks for our residents so that we were able to ensure that we could provide services in a protected environment. We wouldn't want to see those kinds of things go away. The things that we could work on are more the paperwork compliance aspects of what we do that don't really enhance the care or safety of the resident.
How many of your employees, typically, I know we're talking about a variety of institutions, make the minimum wage, and if the minimum wage were increased, it's going to increase your operating cost? So to what extent, or on one hand, we're saying don't cut taxes, and on the other hand, we're going to increase your operating costs?
I know of no facilities that simply pay them. In healthcare today, we have workers.
Clarification, I mean, are you saying no facilities pay minimum wage?
No facilities pay less than minimum wage. No facilities. Yeah, go, Barry. Barry's going to do the numbers for me.
My name is Barry Ray. That's R-A-Y. Thank you. And I am a board member of HCCI. The issue as it relates to minimum wage is a very good question. The fact of the matter is that we certainly meet the minimum wage requirements as they stand right now. However, any increase to the minimum wage will in turn require an increase to the other people that are working in the facility because they want to keep a differential between themselves and minimum wage. Nobody who's making $10 an hour now, who minimum wage is $7.25, if that gets raised to 10, they're going to want to be at 12 and 13 and 14, and I'm sure the people that are standing next to me right here would be happy to join right in and to explain that they couldn't wait for that to happen, and we understand that. So it has a very strong potential impact, irrespective of whether our people are currently getting minimum wage. Ultimately, any change to that will, of course, drive up costs.
You're watching the Illinois Channel.